Hello, I'm Justin Wack, founder of Savvy Accountability. I'm here with Dr. Mark Hansen. Dr. Hansen, we brought you in today to talk about a little more on some of these issues that we've been discussing over the past few weeks about taking care of ourselves, about the shame that drives some of these online behaviors that we're dealing with Savvy, whether it be online pornography, online gaming, online gambling, excessive social networking, just spending our whole night on Facebook, and really trying to look at some of the things that are driving this behavior. I mean, we know these behaviors exist. That's not news to any of us. But what is it that's really driving these behaviors? And so I wanted to invite you back here and talk a little bit more about that. Let's start out with this idea of we've talked a lot about shame. We've talked about shame driving some of these issues and these core longings we've talked about. We all have these core longings that need to be met in our lives. When those aren't met and when there's shame involved, it then drives us to hide and try to self-medicate in some of these destructive ways. Another thing you've mentioned is trauma and how some of these traumatic experiences, some of them more extreme and some of them less extreme, that many of us have dealt with and experienced earlier in our lives. And how that plays into the shame and then how it cycles back and then leads to some of these destructive behaviors. Can you talk to us a little bit more about that today?
Sure. I've indicated in one of our previous sessions, Justin, that shame is the feeling we have about what has been done to us.
Right.
Intentionally or unintentionally. If we get cut with a knife, either on accident or someone intentionally cutting us, it still leaves a wound.
Right.
It's still painful. Yeah. It still hurts. Francine Shapiro defines trauma as any negative event that has had a lasting effect upon self or psyche, and that comes in all shapes and sizes. It can be as simple as bullying, which is not so simple. We hear a lot about that today. When I was a kid, we didn't think much about it. Now they make a big deal about it. Name calling, teasing. But it can be as extreme as losing a child or a spouse or a parent, even if that has not happened. It can be our world is at war many times. There's a war going on somewhere. It can be the loss of someone in that setting. It can be the loss of a son or daughter going off to war, and what am I going to do? And the worry and trauma that comes with that.
Right.
So, and it just depends on the individual, what is traumatic to them. And so we're all susceptible to trauma because we all have that need to belong. We're all relational beings. That's what humans are. Is we're
Right.
relational beings. We're designed to be in community. Unless we're on a deserted island or in some sort of a recluse, we're going to be affected by trauma of some sort. Of course, being off by ourselves without human contact can be traumatic unto itself.
Right.
So because we are alive, we are susceptible to trauma of some sort in our lives.
So talk to me a little bit about this cycle that takes place then. How does that trauma that you've talked about then relate into some of these issues later in life, some of these things that we turn to self-medicate, like we've talked about before? How does that all happen?
Well, trauma hurts. There's a reason they call it a trauma. Not every hospital has a trauma unit. It's usually trauma is thought of as extreme. In most of our lives, it does come in different sizes because and trauma usually means there is some sort of emergency, there is some sort of pain involved that needs to be addressed pretty quickly, at least in physical situations in hospitals. With people, trauma is a matter of it has caused some sort of, it's dented us is one way I look at it. It's put some sort of mark on us, as a saying we use today a lot is, that'll leave a mark.
Right.
There's been something done to us that has left a mark. Now, clinicians, almost all of them will say is that whenever they are dealing with someone who has dealt with trauma, there is almost always shame attached to it.
Okay.
Whatever was done, there's something about there must be something wrong with me for this to have been done, that this is happening to me. So the connection is that we feel this pain. We've talked in previous sessions about there's something driving why they're going to the addiction, why they're going to the pornography, why they're going to Facebook. Something happened there. In my program, we call it an episodic memory. There's something there that is driving that. There's the attachment, the rupture has happened, and there's an attachment issue that they're not feeling a healthy connection. They're looking for it. It is usually almost driven by some sort of trauma. The interesting thing with trauma and shame, trauma almost always causes shame, but shame itself can be traumatizing. Coaches use shame all the time because shame is a good motivator. Coach, you're a soccer player, Justin. We've talked about that. You know, you run like a girl. You kick like a girl. What's it going to do? The whole idea is it's to shame you enough to make you play better, to make you perform better. Parents have done this, well-meaning. Again, trauma and shame can happen as a result, intentionally or unintentionally. If you would just do better, Justin, your grades would come up. Well, I got all B's, Mom. I know, but if you would do better, what's it come back? I'm not enough.
Right.
12 years pastoring, I was an expert at shaming my congregations. If you would just give more, if you would just serve more, you know, it's very shaming. I knew of a pastor one time that her favorite phrase to get people to do things was, don't you want to do something for Jesus? Well, who's going to say no to that, you know? So shaming, using shame as a tool can be traumatic in people's lives because it ends up wounding them. It ends up putting that dent. It ends up leaving a mark that says, I didn't measure up. I wasn't enough.
And that's interesting. You said a lot of times it's not even intentional.
Right.
Like in a situation like of a parent or of a coach, or you know, a pastor. It's all well intended. It's all meant to try to help you, and I feel like they're pushing you and stretching your limits, which is always good.
Sure.
But a lot of times the way it can be done leave an impact that we really don't recognize.
Right, exactly.
So then we see that this trauma causing this shame, the shame being traumatic in of itself, and then this ends up driving us to try to medicate, to try to escape in some other way. So, you know, we look at things like pornography and gaming and gambling, just getting lost in Facebook, you know, for hours on end, and dealing with these situations that way. How can our viewers talk to our viewers a little bit about? Many of them are feeling this. Maybe it was something dramatic, something very extreme that happened in their lives. Maybe it's something smaller. What can we do to deal with this and cope with this in more of a healthy way than turning to some of these destructive behaviors?
Sure. Well, and we've talked about this before, Justin, is the exposure. The curse is the cure with shame. The problem that can happen is that we can just address the situation. We can ask for help. Justin, you know, I need your help, and that's what Savvy does, is set something up so there's an accountability there.
Right.
But we have to get to the heart of what's causing the problem.
Right.
And what can happen is, and probably maybe it has happened with some of our viewers, I've expressed I have this problem. I turn to pornography or I drink too much when I'm hurting. And a lot of times, here comes the trauma and the shame again. Well, you need to quit that behavior.
Right.
Well, I've tried. Well, you need to try harder. You know.
Yeah.
I've used this one. I've repented of. If you had more faith, what it does is it pushes us farther. We feel it's intended to help, but what it does is it just drives us farther because, see, I messed up again. I just messed up again. What it does, if the last time I asked for help, this is what happened, and so it drives us farther. We have to find safe places where and I say safe places, that can be a person. Who can I go to that says, this is a safe person I can go to who's not going to beat me up, but who is going to say, okay, why did you go to the pornography? Why did you go to Facebook? Why were you on there all night long? What's behind that? And keep digging a little bit until they get to the problem. That's what a doctor will do. We're going to run some tests. We didn't find anything here. Okay, let's find out. Let's do this test. They keep digging until they find out what is the problem. Then you can deal with the problem.
So we see these same concepts that Savvy Accountability is based on, this relationship, this accountability, having someone that will ask that tough question, someone that's not afraid to dig a little deeper, and do so in a way that isn't shaming, but just saying,
Right.
look, man, I'm
Right.
here for you.
Absolutely.
I want to help you get through this, and being able to be there through something like Savvy Accountability instantly in that moment of weakness when it's really needed the most.
Absolutely. Absolutely. And I want to encourage you that if you are dealing with any sort of addiction, whether it's being up all night long on Facebook or pornography or alcohol, whatever it is that you're using to medicate and deal with your pain, ask for some help. Go to Savvy Accountability's website, see what they have to offer, and begin getting yourself some help that will help you get to a healthy place in your life.